you, Venus Surgeries. So, see, earlier we used to see patients coming from a community, and even if they had infection, what we in medical language call as sepsis, they were sensitive to most of the routine antibiotics. But in last 8 to 10 years, what has happened is that these patients have become multi-drug resistant. Even infections which are happening to patients who are at home, who are not visiting hospitals routinely, the infections that is happening in them is also resistant to our first line therapy. So we have to go beyond this therapy. When we talk about incidence of increase in sepsis, the incidence has increased almost 10% in last decade. What we say that sepsis was around 28 to 35%, we now say it is around 40 to 45% on an annual basis. The severity of sepsis is increasing. We see a lot of patients coming from community in a very, very critical state, and we have to, utilize our reserve antibiotics, utilize our higher end antibiotics to counteract that kind of sepsis. This was not the phenomena, let us say 8 to 10 years back. The community acquired infections were really treatable infections, and we were more worried about hospital acquired or nosocomial infections. But nowadays the picture is overlapping. Almost same organisms, almost same sensitivity of antibiotics, and the resistance pattern is really, really bad. What antibiotics can we use? Actually, there is no fixed formula to it. Right? Now what happens is, if a patient is coming to us in an infective pathology with multi-organ failure, patients with breathing difficulties, so they may be on some kind of ventilator support, patients with kidney failure, so either their urine output is low or their creatinine is high, patients with low blood pressure. So these are the subset where they will not give us time to wait and watch. We have to hit hard, hit fast. This is the mantra that we follow in critical care for all infective pathologies. Because the spectrum of organisms have changed and their sensitivity pattern has changed, we end up using the higher end, or almost I would say the reserve group of antibiotics to these patients, because we don't want to lose them. There are a lot of combinations available nowadays in the market. We try to utilize them. We also have to see what is the area where we want this antibiotic to act, because there are organ-specific action of these antibiotics. We don't want the side effects of these antibiotics to happen in an already compromised patient. So if a patient who is of renal failure, kidney failure, we will probably give antibiotics who have less nephrotoxicity. We want to give antibiotics which are less nephrotoxicity but with maximum effect, or we need to modify the dose. So the problem that we face nowadays is we have a very, very limited pool of antibiotics to utilize, and we try to juggle around them only so that the best fit combination is given to any particular patient. Why has this sepsis increased? We also need to understand, and partly we are also responsible for it as a community. See, we all will understand that somebody in our family falls ill. We immediately write a prescription without understanding that is this really an area where we need to give antibiotic. It could just be a viral infection. Why do we need to give antibiotic for every fever? It could be a viral infection, but probably we don't want to wait for that period. We prescribe an antibiotic, and that is the reason the increase in usage of antibiotics in the community itself has given rise to antibiotic resistance and these difficult to treat infections. So what I would say, it is difficult right now and things are becoming more and more difficult. There are hardly any new antibiotics in the pipeline. The R&D cost of developing a new antibiotics is huge, and frankly speaking, by the time a pharmaceutical company tries to come up with a new antibiotic, the R&D period is so long that by the time that antibiotic is in the market, probably the resistance pattern is already developed for that particular group. So we don't have much in the pipeline. As responsible clinicians, as responsible members of the society, we need to think what we are prescribing. Prescribe only when it is required.
issued in public interest by Plea Charitable Trust, an initiative of Venus Remedies Limited.